Hello everyone, this is David, and I am calling or making this post on December 25th, which is Christmas, the supposed birth date of Jesus of Nazareth, though we all know it isn't really, but what the heck, had to take something away from you pagans, so we might as well take away your holiday of gift giving. Anyway, it's Christmas Day on 2022. I posted a few days ago that one of my best friends passed away. Now, his mom and I were both nurses. His mom was a nurse for, I think, over 50 years. She's 80 years old, and she used to train me on how to do ventilators and stuff like that, even back in the day when I was still doing nursing. And I've been a nurse for 18 and a half years, and what I'm wanting to talk about is medical information over the internet. Because here's what happened. Now, my homeboy is 5'11", which is 1.803 meters. He was 500 pounds, which is 227.2 kilograms for you non-Americans. And what happened was he has an anxiety problem, and he had what was called a PICC line, peripherally inserted central catheter. So if you want, go ahead and pause this and go ahead and look that up if you're not familiar. But it's an IV that goes from your arm right up into your superior vena cava, SVC vein, the large vein on the right side of your heart. Now, as you can imagine, it's in that vein right, actually technically in the heart by all, measures of everything. And as you can imagine, the last thing you want to do is irritate that area because it's in your heart. Well, my friend got on the internet, and his mom found out the day after he passed about at least 30 different videos in the search engine of how to pull your PICC line at home safely. Okay? Now, when I was a nurse, my first 3.5 years I worked in a nursing home, and believe it or not, on night shift I actually was certified and qualified to insert and do my own PICC line maintenance. Okay? Haven't touched a PICC line in that fashion in over 25 years. And I kept telling my friend, don't mess with that PICC line. That sucker's gonna right near your heart, and that thing gets loose, it could send a tiny piece either into your heart or into your lungs, and I'm sure you can all, agree with me, that's bad, okay? But he had himself convinced that it is okay to be his own doctor, his own nurse. His own mother told him, don't do that. Sure enough, Mom, it came out last night. I think I stepped on it or something. Yeah, wink, wink, nod, nod. Well, sure enough, after much cajoling and everything, he was going to come and tell his mom the truth. But he had to go get a soda. And so he went to get his soda, went back in, and she literally found him flumped over his bed. Now, he is also a hoarder. I didn't know that, but there was a reason I wasn't allowed in the back of the house, and that's because there was stuff stacked literally floor to ceiling. So here is this 80-year-old nurse who hasn't done anything in a long time, and she had to grab him and literally flip him over onto the floor. She had to go run into the bathroom and grab a plunger. It's an old trick we learned from our firefighter EMT friends. Yes, this does actually work now. I can verify it because I have a close friend of mine who had to do it. So here is this 80-year-old woman, and she's on with 911, and they're trying to tell her how to do CPR, and she's like, lady, I know how to do CPR. I just need you to help keep track with me until the paramedics can get here. And so here she is with this big plunger, and she's trying to push all of her weight down because he's, over 500 pounds. She said it actually worked pretty good. And what happened is, almost assuredly, because she showed me the PICC line that he had saved, because he's a hoarder, he saves everything. And the first thing, I didn't even bother to put gloves on, because I can tell you that part of his body never touched blood, because what happened was it snapped and sheared off inside of him. Should have been about 30 to 50% larger than what it was. And of course he poo-pooed it to everybody, tried to tell, oh, don't worry, my mom's a nurse, she looked at it for me, told the home health nurse, everything is just fine. Everything wasn't just fine, and it was never going to be just fine. So now here is his mother. She's had to bury 3 husbands. I can't remember all of her. I think all of her children are gone now, sadly enough. She's got some grandchildren. And Tony, my homeboy's half-sisters, 2 of them. People, you are not doctors, you are not nurses unless you have gone to school for the years and years and years of training. I don't give a rat's ass what you see on TV or what you see on YouTube. You are not doctors, you are not nurses, you are not qualified to do this shit at home. Go see your damn doctor or your nurse, or call them up. Call up the advice line if you're not sure if you should come in. They'll tell you what to do. But unless you are absolutely certified and have had years of training, do not go monkeying around with this crap, especially at home. In a town of less than 20,000 people out in the middle of nowhere, Oregon. Sorry, my cats are having fun fighting over in the next room. You know how they could really care less what Daddy's talking about on camera. And it doesn't matter political party. Tony and I are both liberals. It seems to be coming from the conservatives mostly these days, but stupidity knows no political party. Neither does COVID. Neither does your pick line. Neither does those people who like to pop and drain their own skin warts and things like that. And you see all this stuff. Unless you're Dr. Sandra Pimple Popper, who is a medical doctor and has gone through years and years and years of training and hard work. Trust me, I worked with doctors for over 15 years. I know the abuse that they had to put up with. Trust me. I worked night shift. I've had to wake many of them up at 2 a.m. Saturday, Christmas morning. But for the love of God, if Linda, his mom, was a little bit younger, I would be encouraging her to try and either hit YouTube with a lawsuit or to try and track down as many of these YouTubers as she possibly could and file a class action lawsuit. The very least, file violations of the Oregon Nurse Practice Act, because my homeboy died here in the bustling metropolis of Hermiston, Oregon. Okay, when you people make those kinds of videos, you are giving out medical and or nursing and or pharmaceutical advice, and if you don't have the training for it, I hope you've got a really good liability insurance policy. Because eventually somebody's going to track you down and is going to sue the living bejeebers out of you. And let me tell you, as somebody who has been called to give testimony in a lawsuit, it ain't fun sitting next to or across from a hostile attorney who wants to eat you and everybody that you know for lunch so that he can get a nice payday. Because you went out and decided to give out medical advice and somebody died following your stupidity. I had to sit there, and luckily I came back in time to spend some Christmas with my family, but I'm on the standby on the phone in case she has to call up because she needs help with something or help with his estate or what have you. 80 years old. We should be planning her funeral, not burying her son. And for the love of God, people, whether, no matter who you are, please stop arguing with about money in a funeral home or over their dead body. For God's sakes, have a little class. Here was both of her stepdaughters and arguing with her over Tony's estate. We haven't put Tony's body. We haven't even shut the lid on the coffin. Because she and I had this argument, because as nurses, we've seen it happen all the time. They hope Grandma can come out of her stroke so that she can sign her will and leave everything to her favorite grandson, Mark, while the other 12 grandchildren can all go to hell. And then she can slip back into her coma again and die. We don't care after that, as long as she's got a will naming everything to me. But for God's sakes, have a little bit of class, because here are her 2 daughters, and we haven't had that. Body hasn't even been taken out of the morgue yet, and they're arguing with her. She said, David, you wanted to know when it started? And I said, yeah. She goes, well, before his body arrived at the funeral home. She goes, I hadn't even had dinner yet, and they're arguing before we are driving to the restaurant about what I'm going to do with this stuff, and here's what you should do, Mom. For the love of God, people, have some class when people die. You know, at least feign grief. If you can't, actually show it. And also, people, for the love of God, you are not doctors, you are not nurses. Stop getting all of your information out on the goddamn internet. Go see a real doctor or a real nurse. Get the information from them. And I don't mean a doctor with a PhD in English literature, not that there's anything wrong with that. If I want to know who's better, Shakespeare or some other old-time author, I'll ask you that question. But I'm not going to ask you if I should inject myself with live herpes or not, to see if I can actually cure myself of herpes, even though I don't have herpes. But what the hell, why not? With my friend's heart, you might as well taken a gun and pulled the trigger at any rate, suggesting that he can do it just fine on his own by himself. For the love of God, people, get a clue. You are not doctors, you are not nurses. Do not try this at home. Hope you all have a better Christmas than I did.